Hello and welcome to the health program on Trust Television. I am Aisha Salihu. On this week's episode of the program, Healthy Living, we're taking a look at the intervention of assisted reproductive technology in fertility, especially in women. Or, for context, let's streamline to what is termed as older women in our society today. According to research, assisted reproductive technology, ART, includes all fertility treatments in which either eggs or embryos are handled. In general, ART procedures involve surgically removing eggs from a woman's ovaries, combining them with a sperm in the laboratory, and returning them to the woman's body or donating them to another woman. ART includes artificial insemination, intrauterine insemination, in vitro fertilization, and ovarian stimulation with medicalization. Joining me in the studio to talk extensively on the incorporation of ART as a treatment procedure in many fertility clinics for women seeking children today is Dr. Gilbert Naji, a fertility expert, to explore more insights and perspectives on the subject. Thank you so much for joining us and welcome to Healthy Living, Doctor.
Thank you for having me. Good to be here.
Yes. Now, I'd like for us to do more, start with elaboration on artificial insemination, intrauterine insemination, ovarian stimulation with medicalization, and also in vitro fertilization, just like I introduced earlier.
Okay, basically to start with, the IUI there stands for intrauterine insemination, whereas the IVF there is called in vitro fertilization. They are not the same actually. And both of them are actually referred to be assisted reproductive techniques. They have their own different techniques to help women to conceive that are not able to conceive naturally. Now, the IUI is for women that have a certain medical condition like harsh vaginal environment, this is chronic infections, or those that have what they call cervical stenosis, in which the sperm is difficult for the sperm to pass through the vagina into the uterus. And then for the man may have poor motility, okay, which could make the sperm movement to be delayed, okay, because sometimes when a man has low motility or poor motility, okay, it will take a longer time for the sperm cell to swim to meet the egg during ovulation. So IUI, seems to be a better way to short circuit that process to make, this thing happen quicker. So when it comes to the IVF is particularly for women that are not able to conceive naturally, that have actually gone beyond the age of 35, okay, and they are desperate for children or for a child. So in that case, a woman's egg is being harvested. It's called oocyte retrieval medically, and then a man's sperm is collected or donated and then fertilized outside the body. It's called in vitro. In vitro means outside the body. Okay, it's done outside. So when a man's sperm and the woman's egg is being fertilized outside the body, it will then be transferred into the womb. After the egg and the sperm will have fertilized, after some days, will be transferred into the uterus of this woman, and then it's supposed to implant. So that explains, the differences between IUI and IVF. So they are actually referred to be medical miracles, because without IUI, without IVF, it will have been very difficult for couples to conceive, after they've gone beyond the age of 35 or when they've entered menopause. So yet, these are very wonderful techniques that have helped millions of couples all over the world to have their children. So I think we really should applaud IVF and IUI. It's really helping families to have their children. So it's a good thing. Right.
We're going to come back to IVF because that is really our main focus today. But however, I think you haven't talked on artificial insemination.
Artificial insemination, it's the body that describes, that encompasses IUI and IVF. That is what it means. It means that you're transferring the semen. You're transferring, okay, in terms of IUI, you're actually transferring or depositing the semen or sperm into the uterus of a woman. So it's artificial, it's not natural. Natural means a man and a woman will come together and have intercourse that will produce the child. Artificial means that it is not natural. You're actually transferring the sperm into the womb during the woman's ovulation, which explains IUI. Or you are actually, bringing the sperm, conventional IVF, bringing the sperm and the egg together within a dish for them to fertilize. So it's artificial. It is not natural. Artificial means it's not natural. It's not organic. It's an assisted technique or assisted techniques That is what artificial insemination means.
Now, so back to the IVF, you talked about IVF earlier. Now, we're doing it with we're going to talk about it with a twist to, you did say it's for women who have hit menopause, say older women, and even old women who are above 35.
Okay.
Now, I'd like to know, I'd like to know the success rate, because if you're saying for older women, that means that there is already difficulty for this woman to conceive naturally. So I'd like to know what has been, or what is the success rate for IVF, and also how do we determine the number of children that we get as the outcome, amongst others? Okay,
when it comes to success rate, there are some factors that will determine that. One of them is the sperm of the man. Okay, if the sperm of the man is not healthy, or he has overall sperm quality. And when I talk about sperm quality, we look at the parameters. We look at the sperm count. Is the sperm count adequate? Okay. Is the motility good? Is the morphology good? Morphology explains the overall shape and body of the sperm, while motility defines the movement, the ability to move towards the egg when it's about natural conception. But it's very important that a man has healthy sperm parameters. It will increase fertilization during during IVF culture. And then, two, the egg of this woman. Okay, it is possible for a woman to conceive within the age of 20s and maybe 35. That is when conception happens quicker. But when the woman when the woman's age begins to decline, let's say beyond 35 to 40, it starts to become difficult to achieve natural conception. So the quality of the eggs determine. And women's egg begin to decline as they advance in age. That is one thing to also to mind. Then thirdly, the uterine environment is another very important factor. When a woman has poor uterine environment, let's say the womb is riddled by fibroid, or let's say endometriosis or adenomyosis, these things hinder conception naturally, even IVF. So these three factors are very, very important. They determine the overall success rate of IVF. And then lastly, too, the center where this procedure is done will also determine. Okay, depending on their technique, how advanced they are in terms of knowledge, what to do, the particular drugs to use. So all these things, they interplay to determine the success of IVF. Okay, so for IVF to be successful, the man has to have adequate sperm count, motility, and morphology. That is overall sperm quality. Number two, the woman has to have good egg quality. Okay, and then she has to have good womb uterine environment to enhance implantation. So these three things are key to enable IVF success rates.
Thank you so much for that response. Now, still talking about older women IVF procedure, I'd like for us to explore, it is now very rampant that we have multiple births that are becoming common through IVF.
Okay.
I'd like to know, how do we determine the number of children as part of the success story for IVF?
Okay, now the thing is, when it's about natural conception, naturally the female body produces one egg every month, okay, naturally, okay. But then when it's about IVF is not a natural conception technique, okay. It's an assisted medical technique. So for a woman that aims to achieve conception through IVF, she would be injected with certain hormonal drugs. So that hormonal drugs will create multiple follicular maturation. Okay, because when a woman is making effort to conceive naturally, the female body, one ovary is going to mature and release one dominant egg alone. But when it's about IVF, she's going to be given injections on a daily basis to mature her ovarian follicles. And I'm talking about both sides. The right ovary is going to be maturing eggs, the left ovary is going to be maturing eggs. So at a certain period, she would be admitted in a hospital and those eggs would be harvested. It's called oocyte retrieval. So when it's harvested, then the best eggs would be collected and will be inseminated with the male sperm. So from then after the fertilization, there's going to be embryo formation. Then the healthiest embryos, maybe 3 embryos, 4 embryos, will then be transferred into the uterus of this woman at a particular adequate time. So it now depends on how many embryos would implant. So sometimes 3 embryos implant, depending on on the clinic's decision. Some clinics may decide to transfer 3 embryos or 4 embryos, which that the woman can be able to carry, because age will be determined the number of embryos this woman will be carried, even their physical fitness. So sometimes you transfer 4 embryos and they end up implanting. So it means that this woman will end up having four babies or 4 children or 4 fetuses as the concept may be. Do you understand?
Yes.
That is how most women that go for IVF, a lot of them turn out to have multiple babies or twin pregnancy.
Now,
Okay.
let us look at, say, surgery. I'd like to know the role of surgery, that's cesarean section for IVF.
The role of surgery. Okay, the reason why a lot of clinics advocate cesarean section, okay, it's because of the delicacy of that pregnancy. Because someone has tried to conceive for like let's say 15 years, 10 years, and then you don't want to put that woman through the pressure of push labor. You understand? You want to just go in there and then take out the baby because that's a precious child. That is why a lot of clinics, they advocate cesarean section for a woman that conceive via IVF. And come and think of it too, internationally, in foreign countries like America and UK, it's not a normal practice for them to allow natural birth delivery. They don't. A lot of clinics abroad, they advocate cesarean section. Why? Because you want to retain the sexuality of this woman. You know, and then you hardly even notice that someone did cesarean section because of the techniques and the advanced machine that they use in carrying out their cesarean. So in abroad, it's becoming a gold standard. A woman that wants to have a child, they will just advocate cesarean section. But here in Nigeria, I think we are gradually coming to that stage. Yeah.
Now, this response brings me to my next line of action on the program. Now, a first-time mother, Precious Ifeanyi, welcomed a set of sextuplets at the National Hospital, Abuja.
Okay.
The businesswoman, who has been married for 13 years, gave birth to 4 girls and 2 boys after undergoing in vitro fertilization at a separate clinic before the National Hospital. And the babies were delivered at 30 weeks through cesarean section. The mother, of course, was actually expecting quintuplets, only to find out during delivery that there were 6 babies. Now, I'd like for us to take a look at that report, and we'll have further discussions on that particular report when we get back. The new parents, who had hoped to have their children earlier but couldn't and waited after 13 years of marriage seeking, is thankful to medical technological intervention.
My consultant told me that after assessment, he told me that I won't go home. I have to stay back so that they will monitor me closely to see. Because then I was having difficulty in breathing. Any little thing, my breath will be going up. Any turn, if the children turn, my breath will be going up. People will rush, nurses checking my vitals and all that to see if everything is in order. That was how we kept struggling for more than 1 month. After bringing out 5 children, because they gave me drugs that I didn't really, what was happening was not clear to me, but I was overhearing, it's like there's another one. And actually, that was how the name changed. And that's to show the wonders of God.
That's really changed everything entirely. But before now, it's really a concern. However, there's one thing we know, that God is with us. Since 2010, for us to stay put, looking unto God in faith, in His word, we know one day He will answer us.
Experts at the hospital say her case is a lucky one due to her age, the number of children, and the complications prior to the surgery.
She's 47 years old, which also is associated with complication. Then with the IVF itself, and this we call this higher order pregnancy, anything beyond 3. So we expect complications like that. And she had some of them, but we were able to manage. The most important actually was the contractions, preterm contractions that she was having since she was about 28 weeks, which we were able to quiet until we get to 30 weeks.
In spite of the financial burden this delivery may bring, the couple is hopeful they will find their way in raising the children. And that was the family of Precious Ifeanyi, as she has now recorded success with child delivery. Now, Dr. Gilbert is still here. I'd like to hear your take on this whole IVF, and also she was expecting 5 children, only for her to get to see 6 children. I just want to know, what were the dynamics around all of that?
Well, okay, clinically, I think it will result from the sonographer, or maybe the scanning technique, you know, because while the children were growing up, you know, they also be monitored using pelvic ultrasound scan. Okay, so while they were doing that, they probably missed out one of the children. That's the only way that they could have missed that, because it could be challenging, because when a woman has six babies, fetuses in the womb, it won't be easy for you to be able to capture them, you know, using ultrasound scan. Okay, and that's the technique error there. The sonographer or the radiologist or the doctor that was carrying out that, you know, that scan review, he probably missed out capturing the other fetus. Okay, so that is my own personal opinion. That's what could have happened in that process. Okay.
Now, earlier you talked about complications for older women who have undergone IVF, especially if they're going to end up with a number of babies as an outcome. I'd like to talk more on complications, because she did say at the 16th week, she had to be advised to be bedridden at the hospital, where there's going to be a lot of management because she was having a shortness of breath and among other complications. I'd like to hear from you, what were the cause of this complications? Okay,
now, for such a woman with 6 babies, one of the things I could, you know, that's quite a lot of babies for her to carry, you know, at that age. You know, the complications that could arise, like from someone having what is called, you know, bilateral pedal edema. You understand? Let's say the legs getting swollen, because, you know, those babies are big and they'll be resting on the major blood vessels that are supposed to carry blood towards the chest, and then move it all over the body towards the heart and take it all over the body. So it could have resulted to, you know, to pedal edema because of the number of the children that she's carrying in her womb. So that is one complication. Number 2, I think maternal mortality could also be one of the complications that could but hence I want to believe that she was properly managed. You know, she was well taken care of, monitored regularly, because to have 6 babies in the womb is not an easy thing, okay, because she has to be eating regularly, because those babies will be eating up her food, you know, she has to be eating regularly, and then I want to believe that she was properly taken good care of, for her to have succeeded to have those children without any infantile mortality. Okay.
Now, she was advised to take the cesarean section option at 30 weeks.
Absolutely.
I'd like to know, why 30 weeks?
Well, you know, that because she's carrying a lot of fetuses in the uterus, so that's extended time. You know, 30 weeks, it's just to help those children, you know, because when those children are being taken out at that particular time, you know, they'll be transferred to the incubator. Okay, so that helps them to mature more. Looking at the space, you know, that uterus may not be enough to allow those children to mature to full term, which is at the age of, let's say, 38, 40 weeks. So taking them off is to enable a lot of them to survive. By then, their lungs ought to have matured. So incubator is what they need to attain more maturation, because of the space. The uterine space may not be adequate for all of them to get to full term. And it will also reduce what we're trying to prevent, which is the maternal mortality.
I know that for an expert like you, you would most likely advise older women to go for IVF. But then there is a cost implication. What can you say about that?
Well, and again, maternal mortality is another one too, because for women that want to conceive, let's say they want to go for IVF and they are at the age of 50 or 49, that is when maternal mortality increases, because by that age, you know, their bodies have gotten weaker, the uterine muscles, you know, has already laxed out. So we don't really advise those women to go for IVF. You know, they can opt for alternative assisted reproductive techniques like surrogacy, you know, to lower the chances of maternal mortality and other genetic health issues that could affect even the child at that age. Because at that age, it won't even be acceptable for her to use her egg. She has to go for egg donor, or she has to use a donor. Okay, and then what is called high blood pressure in pregnancy, it can also happen to such kind of person when she decides to conceive at that age. So it's just to save her life, to prevent maternal mortality. That is the essence of not advising women at the age of 50 to go for IVF. They can also try surrogacy as an alternative option.
But I talked about cost implication, because a lot of people will tell you that IVF is really an expensive procedure.
Of course, definitely. You know, IVF is not cheap. It's not for everybody. Okay, it's those that can afford it. Okay, because you know, it's not if people that can afford IVF, those that have stable jobs, those that have the means of making such amount of income. IVF is basically the cost of IVF, depending on the center, is around 1 million to 1.5 just for a cycle. Oh. So you have to be prepared. You have to save money to be able to afford that kind of treatment, and it's not 100% guaranteed. Just to let you know. Okay. So it doesn't mean that your first attempt that you must succeed. No. Okay, you may have to keep trying over and over again until it works. But it certainly works. Okay, you just have to be consistent, be prayerful, and then do what you're asked to do to enable it to work for you.
Now, earlier you talked about surrogacy. You know, of older women asking other women to help carry their children, and also even taking out eggs that are not really their own eggs and using it for this particular procedure. Now, this now brings to the fore the fact that there is now a practice these days. I'm sure you're aware, you are an expert, and you also work at a fertility clinic. There are lots of women these days who come out to say maybe they feel they're not ready to start having children, and they want to just take out their eggs and say keep them somewhere, just like we have sperm banks, to keep them somewhere so that at a later time in the future, when they are ready to start having their babies, they go back and maybe there is artificial insemination or whatever ART procedure they'd like to go for with the egg. Now, another angle to it is that there are also women who are out there for the sake of business. They go to these fertility clinics and then they ask that their eggs are extracted just for economic purposes, for commercial purposes, I beg your pardon, to sell. And I know you may not really want to use that terminology, but then I'd like to hear from you. What are your perspectives on all of these issues?
Well, you know, when this practice started, you know, it was more like a free will donation. You know, when it started in the UK, it was more like but then with time, you know, people started commercializing it, women. Okay, they want to give you their eggs, they want to be compensated, and then it's behind it because they are giving out their own, you know, their own properties, and they feel like, okay, the clinic decides to, okay, let's compensate these people that are giving us their eggs. It now became rampant. Initially, it didn't start like that. It was more like a free will donation, more like charity work. You want to help a family that is not able to conceive, probably because the woman had ovarian health issues. You want to just assist her by donating. You were more like a free will donation. But when it came to, with time, you know, it became a commercial activity. People started using it to make money, to take care of certain financial challenges. And then it's still okay. The law permits that a woman can actually walk into a clinic and donate her eggs, and she'll be given X amount of money. So it's in the law. So it's permissible. Okay?
Now, my concern here is, I know that practice, you said it has been on, and they are now bastardizing it. But my concern here is the fact that they have to be induced with hormonal shots. Well, how safe are these hormonal shots to their health? Because we're hearing that perhaps at a later life, they may have some complications with consistent injections of those hormonal shots just to help them produce more eggs, and so that they can be harvested and for commercial purposes, of course. Okay,
now the thing is, like normally, for a woman to ovulate, the body has to produce its own hormones. Okay, and those hormones are called FSH hormone, follicular stimulating hormone, the luteinizing hormone, and the estrogen hormone. Those hormones are innate to the human body. The body produces them to help a woman's egg to mature, you know, and then for her to ovulate. It's in the body of every woman, naturally. But then, when a woman wants to donate eggs to a clinic or to a family that she knows, because this egg donation is not just one, it has to be many. And then to enable the clinic to get a good number of eggs, she has to be induced with the same hormone, but they are synthetic, but they're the same hormone. They are still FSH, they are still LH, but then they are given in injection form synthetically. So, and it to enable the woman to produce more eggs, okay, more than 5 eggs, let's say up to 10 eggs, because when it comes to IVF, the reason why doctors transfer more than 2 embryos is to enable the survival or the implantation of at least 2 embryos, to enable the procedure to work. Because sometimes you transfer only 1 egg and it fails. So for you to get a success, you ought to transfer like up to 2 or 3 embryos. Because this procedure is not cheap, it's expensive. Okay, so you want this couple to win. That's the reason why you could transfer up to 2 or 3 embryos to enable the procedure to work out. Do you understand? So the hormones given to this woman, they are still the hormones that, that the female body produces naturally. Okay, but the only complication that can arise is for them to, to feel sick. Some of them could also add weight because they are given, a lot of them are given estrogen hormones. Okay, so they can put on weight. Okay, but they're not lethal hormones. They don't kill. Okay, they don't kill. They're just, our natural hormone, but then they are not given synthetically. They are not produced and then given synthetically to the body to enable the female ovaries to mature, produce more eggs, which is ovulation.
I asked that question because I'd like to know, say, for a woman who's into donation now,
okay,
whether for commercial purpose or not, and you're talking about how they stimulate them with the normal hormones that the woman produces, but this one is the synthetic one now.
Yes.
And you said, say in a month, a woman is naturally expected to produce just 1 egg. But then because of these shots that are given to them, they're producing, say, 3 or 4 eggs as the case may be. Now, let's say this woman who's doing this donation, either for commercial purpose or for just the sake of charity, just going to donate to clinics to help couples who are struggling. I'd like to know, what is the medical advice for women who intend to carry on this? How persistent, how often should they go about this? Say, in a space of a year, because we're looking at monthly, right? So in a space of a year, how often should they do that, or should they take the shots just so they can give out their eggs? Because you did say that a woman has a certain number of eggs in their system. So if you're doing this for the sake of charity or you're doing this for commercial purpose, what if in a year you keep doing the same every month and then you may just run out of your eggs? I'd like to hear more.
A lot of them are advised not to do that for 2 times throughout their lifetime, like some of these ladies that come for egg donation. But they could do that once in a year, and then they'll be asked, how often have you done this? If they say they've done it like more than 3 times, they could be rejected. Why? Because you want to help this woman, because this woman may one day want to also have her own children. So you want to just help to preserve her fertility. Okay, but some of them are stubborn. They may go to clinic X, clinic A to do egg donation, and then after that, the next 3 months, they go to clinic B. And then, who do you trust? When you ask them, some of them even give you false information. So then it's not your fault. It becomes the fault of the potential donors. But they're usually advised, do not donate egg more than 3 times, okay, throughout your lifetime.
Thank you so much, Dr. Gilbert Naji, fertility expert at a private clinic in Abuja. This is the much we can take at the moment. We do hope to reconnect with you in subsequent episodes of the program to have your thoughts.
You're welcome.
And that concludes this week's episode of the program, Healthy Living on Trust Television. For comments, contributions, and suggestions, do well to follow and subscribe to all Trust TV social media handles. Download the Trust TV app on iOS and Android devices across their respective stores and get live updates on the YouTube live stream and the website. Join us next time as we continue to explore subjects crucial to your health and well-being. I'm Aisha Salihu. Thanks for your time.